Have you ever wondered how a thyroidectomy is performed? Well, you're about to find out. This video aims to demystify the process of a thyroidectomy, providing a step-by-step guide to this common surgical procedure. A thyroidectomy, for those who may not know, is a surgical operation that involves the removal of part or all of the thyroid gland. This small, butterfly-shaped organ, nestled in your neck, plays a big role in your body. It churns out hormones that regulate metabolism, influencing how your body uses energy, stays warm, and even how it keeps your brain, heart, and other organs functioning properly. Why might someone need a thyroidectomy? Well, reasons can range from cancerous nodules to an overactive thyroid that's creating too much hormone, or even a large thyroid that's making it hard to breathe or swallow. Now that you know what a thyroidectomy is, let's delve into the steps involved in this procedure. Before the thyroidectomy, several important steps are taken to ensure the patient's safety and prepare for the operation. The journey begins with a thorough review of the patient's medical history. This is crucial to understanding the patient's overall health and identifying any potential complications that may arise during the procedure. Next comes the physical examination. This involves a comprehensive check of the patient's vital signs and a detailed examination of the neck area to assess the size and location of the thyroid gland. Concurrently, essential blood tests are carried out to evaluate the patient's overall health and thyroid function, while imaging studies such as ultrasound or CT scans provide a clear picture of the thyroid gland and surrounding structures. An anesthesia consultation is also an integral part of the process, where the anesthesiologist discusses the benefits and risks of anesthesia with the patient. And of course, the importance of informed consent cannot be overstated. The medical team ensures the patient understands the procedure, its potential risks, and benefits. Once these steps are completed, the patient is ready for the thyroidectomy. With the patient prepared, it's time to begin the thyroidectomy. Just like any other surgical procedure, the first and foremost priority is the patient's comfort and safety. So let's take a closer look at the initial steps involved in this procedure. Firstly, the patient is positioned on the operating table with care taken to ensure maximum comfort. The neck is slightly extended to provide the surgeon with the best possible access to the thyroid region. Next, we have the administration of anesthesia. General anesthesia is typically used for this procedure, ensuring the patient feels no discomfort during the operation. The anesthesiologist monitors the patient's vital signs throughout the procedure to maintain a safe and stable environment. Once the patient is comfortably sedated, it's time to prepare the surgical area. This involves cleaning and sterilizing the skin around the neck to minimize the risk of infection. A sterile drape is then placed over the patient, leaving only the surgical area exposed. Now we're ready for the incision. The surgeon will make a horizontal cut in the lower part of the neck, right above the collarbone. This incision is typically about 2 to 3 inches long, but it can vary depending on the patient's anatomy and the extent of the thyroid disease. The surgeon will then carefully separate the underlying tissue to expose the thyroid gland. It's important to remember that every step is carried out with the utmost precision. The goal is to minimize trauma to the surrounding tissues and structures, including the vocal cords and parathyroid glands, which are located near the thyroid gland. And with that, we've reached the end of the initial steps of the thyroidectomy. It's a process that requires a deep understanding of anatomy, meticulous surgical technique, and above all, a commitment to patient safety and comfort. With the incision made, we can now proceed to the next step of the thyroidectomy. Now comes the critical part of the thyroidectomy, removing the thyroid gland. In the delicate dance of surgery, the thyroid gland is the star. The surgeon, with a steady hand and a keen eye, must first identify the thyroid gland. It's typically located in the lower part of the neck, just below the Adam's apple. It's a butterfly-shaped organ with 2 lobes, connected by a thin strip of tissue called the isthmus. Next, the surgeon must isolate the thyroid gland. This involves delicately separating it from the surrounding tissues, including the trachea or windpipe and the esophagus, which carries food from the mouth to the stomach. This step is crucial as it allows the surgeon to have a clear view and access to the thyroid gland, making the removal process more precise and safe. But the thyroid gland is not an island. It's nestled amongst other important structures that must be protected during the surgery. These include the vocal cords, which are responsible for our ability to speak, and the parathyroid glands, which regulate calcium levels in the body. The surgeon must carefully navigate around these structures, ensuring they remain unharmed. Then comes the actual removal of the thyroid gland. Using specialized surgical tools, the surgeon delicately detaches the gland from its connections, carefully avoiding damage to the surrounding structures. The gland is then removed from the body, marking the end of its role in the body's endocrine system. However, like any surgery, a thyroidectomy is not without potential complications. There may be bleeding, infection, or damage to the surrounding structures. But rest assured, these are rare, and surgeons are well prepared to manage these situations. They have strategies in place to minimize these risks, and if complications do occur, they are equipped with the skills and knowledge to handle them effectively. With the thyroid gland successfully removed, the next step is to close the incision. The completion of this stage signifies the end of the most critical part of a thyroidectomy. But the surgeon's work is not yet done. The patient's journey towards recovery is just beginning. Closing the incision is the final step of the thyroidectomy. This is a crucial phase that requires utmost precision and care by the surgeon. The method used to close the incision can vary, but typically it involves either stitches or staples. Stitches, also known as sutures, are often used because they provide a secure and neat closure. They are threaded through the skin's edges, effectively holding the wound together as it heals. On the other hand, staples might be chosen for their speed and efficiency. These metal clips are quickly applied and can be removed easily once the healing process is complete. In some cases, a drain may be placed underneath the incision. This is a small tube that helps remove excess fluid from the surgical area, reducing the risk of swelling and infection. With these steps meticulously performed and the incision closed, the thyroidectomy is complete. The thyroidectomy is over, but what happens next? Post-operative care is an essential part of the recovery process. It involves several components, each as important as the last, to ensure a smooth transition from the operating room back to the comfort of your own home. Firstly, pain management. It's natural to experience some discomfort after surgery. Pain is subjective, varying from person to person, but rest assured, your healthcare team has got your back. They will provide you with appropriate pain relief medications and instructions on how to use them effectively. Remember, managing your pain isn't a sign of weakness but a step towards a faster recovery. Next, let's talk about wound care. The incision site needs to be kept clean and dry to prevent infection. Your medical team will guide you on how to properly care for your wound at home. They'll teach you how to change the dressing, what signs of infection to look out for, and when to seek immediate medical attention. It's crucial to follow these instructions diligently. Monitoring for complications is another vital aspect of post-operative care. Complications can include hoarseness, difficulty swallowing, or changes in your voice. If you notice any of these, it's important to notify your healthcare provider immediately. Once you've navigated these initial stages of recovery, it's time for follow-up appointments. These are scheduled to monitor your healing progress, adjust any medications if needed, and answer any questions or concerns you might have. These appointments are your chance to voice any issues you might be experiencing, so don't hesitate to speak up. Finally, we arrive at long-term care. If your entire thyroid was removed, you'll likely need hormone replacement therapy. This therapy, in the form of daily medication, is necessary to replace the hormones your thyroid would typically produce. Regular checkups will be needed to ensure the correct dosage is maintained over time. Though the procedure is over, comprehensive aftercare is crucial for a successful recovery. Remember, your healthcare journey doesn't end when you leave the operating room. It's an ongoing process to ensure your well-being. Let's quickly recap the key points about a thyroidectomy. This surgical procedure involves the removal of all or part of the thyroid gland, a small organ located at the base of your neck. Preoperative preparation is essential, including a thorough evaluation of your health and a detailed discussion with your healthcare provider about the risks and benefits. The procedure itself begins with a small incision in the neck, followed by the careful removal of the thyroid gland. Surgeons must be meticulous to avoid harming surrounding structures like the vocal cords and parathyroid glands. After the procedure, the incision is closed and post-operative care begins. This includes monitoring vital signs, managing pain, and checking for any potential complications. Finally, patients will need ongoing care and follow-up appointments to monitor their health and adjust medications as needed. Understanding the thyroidectomy procedure can demystify the process and help patients and health professionals alike navigate this common surgery.